Time for Health Watch now at 8:11 this Friday morning. Reducing the risk of breast cancer. Researchers at a major conference in Europe said yesterday that a few simple lifestyle changes could lower the number of breast cancer cases by 1/3. Last year, more than 190,000 new cases of invasive breast cancer were diagnosed. Our Dr. Jennifer Ashton is here with the latest information. Good morning, Jen.
Good morning, Maggie.
So the first thing we want to do is debunk the myth that your risk of getting breast cancer has mostly to do with your genes.
That's right. Now, in medicine, we talk all the time about the importance of your family history, and with breast cancer, it's no different. It is important, but actually only about 5 to 10% of breast cancers are what we call hereditary in nature. So that's based on your genes. The rest, very complicated interplay of a variety of factors, some of which are under our control and some of which are not.
Let's talk about what's within our control and what this new research shows. There are things you can do in your life, 3 simple changes you can make that will greatly reduce your risk.
Exactly. And really, the first one has to do with your diet. If you eat 4 to 5 servings of fruits and vegetables a day, you can lower your risk of breast cancer. So, you know, that's not so easy for everyone, but it does tell you that what you eat is very important. The thinking is that certain high-fat foods or high-caloric foods increase your body fat level. That, in turn, interacts with estrogen. So, again, lots of fruits and vegetables, whole grains, low animal fat, vitamin D. If you're not getting it in supplementary form, you can get it in enriched foods, all very important.
Another way we can keep our fat down, and we talked about this already earlier this week, is exercising. How important it is specifically for women, but also to reduce breast cancer.
Absolutely important for your heart, also important for breast cancer and every cancer. So actually about 60 minutes of exercise a day, but we really want to emphasize some is better than nothing. So you want to get moving, and that risk reduction is seen whether you exercise early in life and then taper off as you get older, or if you start late. It's never too late to start.
It's never too late.
That's right.
What about alcohol? Alcohol in moderation has been proven to have health benefits where some things are concerned. What about breast cancer?
This is, again, complex and controversial. For women at high risk of breast cancer, they really want to be very strict and not consume more than 1 alcoholic beverage a day. For the average risk woman, so that's really all of the rest of us, 1 in 8 women face a diagnosis of breast cancer over their lifetime. Studies have shown that those who consume 2 or more alcoholic beverages a day, or on average a week, meaning 14 a week, greatly increase the risk of breast cancer. Again, not clear why, but this is one of those things that in moderation you want to be careful.
And lastly, something that caught my eye in the study for obvious reasons is something that new moms can do to reduce their risk of breast cancer.
Breastfeeding, hugely important. Again, women who breastfeed their babies at all, or certainly the longer the better, have shown a reduction in their risk of breast cancer, probably because of hormonal issues. We know that breastfeeding suppresses the body's production of estrogen, and again, that can be protective. So this is something you can do early in life to reduce your risk later.
The one and only Jen Ashton. Thank you, buddy. Good to have you.
A lot happens early on The Early Show, weekday mornings on CBS.